Imagine you are living in the early 20th century. Your child has been suffering from a persistent cough for weeks. In an era before antibiotics, when tuberculosis was a death sentence, coughs weren't just an annoyance. They brought sheer terror. Desperate, you walk into a pharmacy. The pharmacist smiles and hands you a neat little bottle, elegantly labeled by one of the world's most prestigious pharmaceutical companies of the time. The promise on the packaging is irresistible. A sweet syrup, absolutely safe, suitable even for infants, curing everything from the common cold to asthma and tuberculosis. And most importantly, it is advertised as completely non-addictive. You take it home and give it to your child every day. The cough completely stops. Your child falls into a peaceful sleep, and you believe you have found a miracle. But you have no idea that the miracle you just legally fed to your little one is actually one of the most devastatingly destructive drugs in human history. Today, we are reopening the files on the white powder that once proudly sat on every family's medicine cabinet, long before it became the center of underworld wars, notorious crime syndicates, and a global health crisis that has yet to see an end. Welcome to the history of heroin. To understand the origins of heroin, we must go back thousands of years to its mother, the opium poppy. As early as 3400 BC, the Sumerians in Mesopotamia cultivated this plant and called it hul-gil, the joy plant. Its resin, opium, has accompanied humanity through countless eras, used to relieve pain and soothe the mind from ancient Egypt to the Eastern empires. But natural opium had a limit. As modern medicine began to take shape in the 19th century, scientists sought more powerful, purer, active ingredients. In 1803, morphine was born, becoming the greatest painkiller of its time. But it also created millions of new addicts following the American Civil War. Science needed a solution. They needed a painkiller as strong as morphine, but without the addictive properties. In 1874, at St. Mary's Hospital in London, an English chemist named C.R. Alder Wright conducted an experiment. He boiled morphine with several other chemicals and created a new compound, diacetylmorphine. Wright tested this substance on dogs and rabbits, but the results were terrible. The animals reacted violently, vomiting and panicking. Wright recorded the results, shrugged it off, and tucked the formula away in a drawer. To him, it was merely a chemical failure with no practical value. This seemed insignificant at the time, but it wasn't. More than 2 decades later, in 1897, thousands of miles away from London, a young chemist named Felix Hoffmann was working for the pharmaceutical company Bayer in Germany. Hoffmann was enjoying the brightest days of his career. Just 2 weeks earlier, he had successfully synthesized aspirin, the world's greatest painkiller. And now, rummaging through old chemical texts, Hoffmann successfully resynthesized Wright's diacetylmorphine. This time, Bayer didn't test it lightly. When Bayer employees tested the substance on themselves, they reported extreme euphoria, a surge of excitement in their chests that made them feel strong, brave, and utterly fearless. In German, the word for heroic is heroisch. And so, a brand name full of pride and arrogance was born. They called it heroin. No one in that laboratory that day could have imagined they had just opened the Pandora's box of the 20th century. In 1898, Bayer officially launched heroin onto the global market. Their marketing campaign was one of the most grandiose promotional efforts in medical history at the time. Tens of thousands of free samples were sent to doctors in 23 countries. Heroin was introduced not just as a cough medicine, but as a miracle drug for asthma, pneumonia, and even as a cure for morphine addiction. Bayer advertised it as being 5 times stronger than morphine, yet non-addictive. The medical community initially embraced it with sheer joy. It was genuinely effective at suppressing coughs because the nature of opioids is to slow down the respiratory system. Doctors prescribed it for adults. Parents bought it for their children. Bottles of heroin cough syrup casually appeared on the dining tables of middle-class families in America and Europe. But this honeymoon didn't last long. Entering the early 1900s, doctors in the US and Europe started noticing a strange phenomenon that quickly turned terrifying. Their patients kept returning to the clinics, and it wasn't because they were coughing. They came back because they craved the syrup. When cut off, these patients experienced convulsions, cold sweats, diarrhea, and bone pain so severe they wanted to tear their own skin off, falling into states of sheer panic. These were not side effects. This was withdrawal. A small number of doctors began sounding the alarm. They wrote in medical journals, questioning Bayer's non-addictive claims. However, in an era before strict regulatory bodies like today's FDA, these voices were initially dismissed, entirely drowned out by the massive media power of the pharmaceutical giant. But the truth couldn't be hidden once tuberculosis patients started selling off all their belongings, rushing to the black market to buy heroin at any cost. Hospitals recorded skyrocketing addiction rates. Instead of being the cure for morphine addiction as promised, heroin had created a new generation of addicts with a dependency far more horrifying than before. By 1913, facing immense pressure from the medical community and undeniable evidence of the drug's devastation, Bayer quietly stopped producing heroin. But it was too late. The monster had already been let out of its cage. Bayer's customers were no longer tuberculosis patients. They had become junkies. And wherever there is desperate demand, the criminal underworld appears. When the pharmaceutical companies pulled out, a massive void was created. The turning point that permanently altered heroin's status was the Harrison Narcotics Tax Act, passed in the U.S. in 1914, followed by a total ban on the production and sale of heroin in 1924. Internationally, the League of Nations also began tightening control treaties. Heroin was officially stripped of its medical white coat. It was pushed down into the underground streets, falling straight into the hands of a new power: organized crime syndicates. When banned, heroin didn't disappear. It simply changed its supply chain, becoming more expensive and far more violent. In the mid-20th century, a notorious smuggling network was born, changing the face of global crime: the French Connection. Imagine this network as an invisible multinational corporation. Opium was legally grown in Turkey. Then, it was smuggled across the Mediterranean Sea to the French city of Marseille. There, in underground laboratories run by the Corsican mafia, skilled cooks refined the opium into No. 4 heroin, the purest heroin in the world at the time, pure white and completely water-soluble. From Marseille, the heroin was hidden in cars, suitcases, and even ships, smuggled into New York and major U.S. cities, distributed by the Italian-American mafia. Transitioning heroin from a medical drug to an illicit commodity turned it into a hyper-profitable currency for the underworld. Gang violence escalated. Bloody purges erupted on the streets of New York. The value of heroin multiplied hundreds of times with every exchange. From this point on, heroin didn't just kill people by destroying the users' bodies. It started killing people with gangland bullets and by manipulating corrupt political systems. But the climax of this tragedy wasn't over yet. It was waiting in a tropical jungle halfway across the globe from America. In the 1960s and 1970s, the world witnessed two massive historical events accidentally intertwine, creating a nightmare that humanity still suffers from today. The first event, the Vietnam War and the rise of the Golden Triangle. When the French Connection network was dismantled, the market suddenly shifted to Southeast Asia, specifically the border tri-junction of Thailand, Laos, and Myanmar. There, Amidst the chaos of war and warlord factions, heroin production exploded, and their biggest customers weren't far away. They were the American soldiers fighting in Vietnam. Facing the horrors of war, profound loneliness, and near-death experiences every day, many U.S. servicemen turned to drugs to escape reality. Heroin in Southeast Asia during this time was incredibly pure, up to 90 to 95%, and astonishingly cheap. American soldiers didn't even need to inject it. They could lace it in cigarettes or smoke it directly. In 1971, a shocking report was sent to the White House. An estimated 15 to 20% of American soldiers in Vietnam were addicted to heroin. This caused absolute panic for the U.S. government. President Richard Nixon had to go on national television, declaring drugs public enemy number one and officially launching the war on drugs, a campaign that would consume trillions of dollars over the following decades. Every serviceman, before boarding a plane home, was required to undergo a urine test in a campaign dubbed Operation Golden Flow. The second event, and perhaps the most devastating consequence heroin left for the modern era, the HIV and AIDS epidemic. Entering the 1980s, heroin prices plummeted miserably due to competition from South American drug cartels, but its purity dropped as well. To achieve the maximum high with this adulterated heroin, users switched to the most direct and dangerous method: intravenous injection. In dark slums from New York to London, thousands of people shared syringes. When the HIV virus emerged in the early 80s, these blood-stained needles became a superhighway for the virus to spread. In many cities around the world, HIV infection rates among heroin injectors reached catastrophic levels. Heroin was no longer just a story of overdoses. It had become an indirect catalyst, accelerating one of the worst medical pandemics of the 20th century, claiming millions of lives, leaving children orphaned, and creating a social wound that could never truly heal. Today, the image of sneaky smugglers at the port of Marseille or the poppy fields of the Golden Triangle seems to have faded into the past. Global wars on drugs have destroyed many gangs and burned countless plantations. But the ghost of opioids has never vanished. It merely evolved. The most surprising and bitter truth about the history of heroin does not lie in the power of criminal gangs. It lies in a cruel historical loop driven by the medical industry itself and by human greed. We are currently living in the 2020s, in the eye of the storm of a new opioid crisis. Every year, tens of thousands of people lose their lives to overdoses, but not just from heroin, rather, from its synthetic cousin. Fentanyl, a cheap chemical, easy to produce in private labs, and 50 times stronger than heroin. And do you know the root cause that ignited this modern addiction pandemic? It began in the late 1990s, when giant pharmaceutical companies, most notably Purdue Pharma, launched a new painkiller called OxyContin. They trained thousands of sales reps to visit clinics, launched massive advertising campaigns, and convinced doctors to prescribe this drug to patients. Their selling point? It is incredibly effective and absolutely safe because its slow-release formula makes it completely non-addictive. Millions of Americans were legally prescribed painkillers. When they became addicted and the government tightened prescription sales, these desperate patients were cut off from their supply. They had no choice but to hit the streets, seeking cheap heroin, and ultimately falling victim to fentanyl. History has repeated itself with terrifying perfection. In 1898, Bayer introduced heroin to cure morphine addiction, advertising it as non-addictive. Exactly a century later, in 1996, Purdue Pharma introduced OxyContin, also advertising it as a non-addictive painkiller, only to inadvertently create millions of new addicts for the street heroin and fentanyl market. The chemical that was once named heroic ultimately tells us a story about the darkest corners of humanity. It shows the incredibly fragile boundary between medicine that saves lives and poison that kills, between a desperate patient and an addict rejected by society, and between legally protected billion-dollar corporations and brutal street gangs. Thank you for watching. What do you think about this terrifying historical loop? In the future, will humanity continue to invent a new, non-addictive miracle drug to solve the aftermath of fentanyl? Leave your thoughts in the comments, and don't forget to subscribe to help us uncover more shocking historical truths in our upcoming videos. See you next time.